Thank you, Professor Korczyn, dear chairing committee, ladies and gentlemen. And again, Professor Korczyn and organizing committee, thank you for providing me with the opportunity of presenting, expressing the wellness coaching perspective on medicine. I have nothing to disclose, so I will move on straightly to the presentation. The title of the presentation is Wellness, Coaching and Medicine. What do they have in common? And in order to answer this question, I will walk you through a larger context in which I place medicine, that is the evolution of human consciousness, psychology, also the body of knowledge that is related to coaching, wellness, and medicine. We will briefly discuss the origins of each of those fields and the definitions and methods, the applications and for whom they are meant. Are they evidence-based and to which extent, and how do they merge together? And this will lead us to the final conclusions. So, wellness, coaching, and medicine in close-up. The word wellness was first used in the 17th century, according to the Oxford Dictionary. But it is not until the human potential movement, which forged the ground, the humanistic psychology, and I'm very happy to present after Professor Georgianis, because he kind of led the ground for what I'm talking about, the human part of being a medical doctor. And in the 1960s, the wellness movement was begun by Halbert Dunn, a visionary, a physician, and somebody who was also head of vital statistics in the US Department of Health. And he published a book called High Level Wellness, or the book was published for him really, and the book included his talks from a Unitarian church in Virginia. He was the author of, in 1959, he published an article where he, for the first time, used the word positive health, which is today mostly attributed to positive psychology. And his inspiring philosophy and approach led to the further development of the wellness movement in the United States and was carried on by mostly physicians such as Dr. John Travis and Bill Hedler, Don Erdell, who contributed to the body of knowledge around wellness by creating new models of wellness and self-assessment tools, and also by speaking and writing about the field. And it is not until the 1980s that wellness spread globally and moved into the academic, corporate, and medical realms. Coaching is has a very interesting history because it was influenced by so many fields. But the first emergence, that's for the sake of making it very simple and brief, in the 1970s, coaching emerged first in business, most probably as a result of an unmet need in a change of leadership and organizational culture. Then it moved out from the business in the late 1980s and emerged as a distinct discipline in the 1990s. And from beginning with the 1990s, 1995, it continued spreading. Today, holistic as it is, it's also very specialized because it contains specialties like from business and executive coaching towards teen and parental coaching. And medicine, so the beginnings of medicine 49,000 years ago with use of medicinal herbs by the Neanderthals. And I can say that, to present the history of medicine in a close-up, I had to be very subjective in choosing the facts that I will be talking about. So I would like to point to two facts. One from the pre-Columbian America, the Maya civilization, who had healers known as Amen, who spent time discussing their patients' personal life, habits, and worries, just like we do in coaching or in psychotherapy as well. And a very interesting example, and I am honored to be talking about it in Athens, is the Asklepion, which was the ancient hospital. And how was medicine practiced in the Asklepion? The patients were healed in their dreams through connecting with the divine, with the god Asklepios. And in order to be able to do that, their bodies were prepared. They were wearing white garments. Their minds were cleaned as well in order to be able to meet with the divine element, which is called also the practice of theurgy, a meeting with the divine element for healing. And interestingly also, I have read that in this setting, the power of positive suggestion was being used, because when the patients were waking up from the dream, they were walking in a tunnel, and the doctors from that time were whispering from above, "You are healed, you are healed." And why I'm talking about it is because those ritualistic practices may seem to be magical in nature. And I'm presenting here one of the quadrants, really, a part of the evolutionary view of the development of culture and worldview in the theory of philosopher Ken Wilber. So maybe that was magical. Where are we today? Where can we place ourselves today? We have mainstream medicine is still dominated by the scientific rational paradigm. And I really deeply care personally about moving it forward so that these old practices, spirit-related practices, could merge with the biomedical model and with the evidence-based medicine as related to the intervention on the human body. And this is a long citation, but I find it really interesting, and I would like to read it to you. It comes from the work of David Hawkins, who is a physician, psychiatrist, and spiritual researcher, that the body cannot experience itself. The arm cannot experience its armness. The leg cannot experience its legness. But the body is experienced through sensations. But the sensations themselves cannot really experience themselves. So even mind cannot experience itself. So the reason we become aware of what is going on in mind is because of consciousness. And this is why I'm bringing this perspective of consciousness into medicine. Because sometimes it may be useful to think of solving a problem at the next level. So if an illness manifests in a physical way, it doesn't mean that its origin or its treatment ought to be physical, in the words of one of physicians, James Gordon. And relating back to, you must be aware of this definition of health is very known of the World Health Organization from 1948, that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. But interestingly enough, in 1984, the World Health Organization added some components to it, including the spiritual component. And it relates to how health is perceived from a wellness perspective. This is a model called the iceberg model of health and disease, created by Dr. John Travis. And it depicts that the state of health cannot be looked on its own. It has deeper layers, such as lifestyle, psychological, motivational levels, and the spiritual. And this is the illness-wellness continuum, which I am aware is present in some countries in medical education, and it's vital to the understanding of wellness and medicine and how they connect. This model presents the treatment paradigm, which is used in medicine, as part of a larger paradigm of wellness, meaning that these two paradigms must work in harmony, according to the wellness theory. So a patient can be at a neutral point with no discernible illness or wellness, so maybe thinking, well, if I'm not ill, I must be well. But there is so much more than he or she can accomplish towards high-level wellness in terms of awareness, education, and growth. And you must know people who are maybe physically impaired, but they're happy people. They're spiritually, emotionally healthy people. And there are also those who are young and thriving in their bodies, but who seem to be so miserable. And these people do not look in the direction of high level of wellness. Just to give you an idea, be very precise in my talking, the definitions of wellness is a conscious, self-directed and evolving process of achieving full potential. It's the integration of body, mind, spirit, the appreciation that everything you do and think and feel and believe has an impact on your state of health. And coaching is partnering with clients in a thought-provoking and creative process that inspires them to maximize their personal and professional potential. Wellness coaching is using the principles of life coaching to the goals of lifestyle improvement and higher levels of wellness. For whom are they meant? So medicine is destined to the left-hand side of the continuum. Wellness and coaching can be entered at any place on the continuum, from where somebody has some health challenges or not. Some applications of wellness coaching, people with health challenges, reducing risk factors after the warning signal for medical compliance, reintegrating life after a major medical intervention, in the process of recovering from injury or illness, in supporting a patient in grieving the loss of health, and also for work-life balance, self-care, stress management, lifestyle change, increasing overall quality of life, and facilitating any change towards a desired goal. So are these fields evidence-based? So this is something that coaching and wellness need to learn from medicine, that to the extent it is possible, that it needs to provide a body of knowledge which will prove its value for medicine as well. And this body of knowledge is already existent. There is growing evidence that coaching works. I am aware of 12 randomized controlled studies with positive results. In the medical literature, it is said that coaching is effective in improving health outcomes in cardiovascular disease, diabetes, asthma, cancer pain, and weight loss. And to give you an idea, I'll present just one of the trials, the COACH program, which is called the Coaching Patients on Achieving Cardiovascular Health, a multi-centered, randomized controlled trial in almost 800 patients in 6 university teaching hospitals, which resulted in total cholesterol drops of 14 milligrams higher in the coaching, with the group with a coaching intervention compared to the group which received usual care. And just to give you an idea of, because maybe you may be thinking of, you could use coaching in the place where you're practicing medicine. The program's duration was 6 months, and each patient received 5 telephonic coaching sessions of 20 to 30 minutes. And the conclusions was that coaching proved to be a highly effective strategy in reducing coronary risk factors and has potential effectiveness in the whole area of chronic disease. From my own perspective, I'd like to present a case study with a person aged 52 who was a patient with epilepsy, and who lives in a small town, married, a caregiver for her parents, 80-year-old parents, a caregiver for her husband in terminal stage of cancer, and licensed from work because of her illness. So these were the goals that we were pursuing for coaching, and this is what she said after 6 telephonic sessions. It's easier for me to accept what is. I feel empowered. I'm ready to take action. We have found a way for me. I'm stronger. I have the courage to tell my truth. I am decided. I'm more motivated and I have more energy. I have more belief in my own capacities. I want to be more self-kind. I have a say, and they have to take it into account. And this relates to the goal of setting boundaries. So the coaching, I'm saying this because I really want to convey this message to you that coaching is very potent and it has great potential in the healthcare system. And when I'm thinking, while we're talking about wellness and coaching and medicine that go together, they need to learn from one another. And it's through the interdisciplinarity that the evolution takes place. So I have already presented 2 years ago the evolution of paradigm from treatment to creating wellness, and I will not be going into detail into it, but I will discuss the evolving mindset that is required for the evolution of this mindset. So the mindset is moving from how can I treat or cure the patient to the next level, which is how can I provide both my expertise and a healing relationship to the patient. And one level further is how can I support the patient in understanding the meaning of her illness and mobilizing his or her self-healing capacities. So the coaching mindset requires that we see the patient as a whole person, as creative, resourceful, and whole, which means that we do not focus on disease, but we connect with the greatest possibility of healing and wellness in our patients. In the words of Bernice Igel, when a doctor cures cancer or some other disease without ensuring that the treatment addresses the patient's entire life, a new illness may appear. And there is a phenomenon in quantum physics known as that focusing attention on something makes it happen. Basically, it's a very simplified way of saying this, but it's confirmed by physicists like John Wheeler, who created the concept of a participatory universe, where we are co-creators of our reality. So it's so important to have, for your patients, a healing intention and a vision. I've read stories of people who healed themselves, many stories, and they often say that they experienced themselves as though they were already healed. So it requires a mindset of thinking from the point of completion rather than about the difficulty of how to get there, to this healing. And you are all aware of the placebo effect and how belief influences even the physiology. And in the very same way, on the flip side, there is the nocebo effect, the power of negative suggestion on the damage of health. And we all live, all doctors, patients, we really don't need to make a difference here because we all humans with some thought and emotional patterns. And in the words of famous neuroscientist and neuroimmunologist, Dr. Candace Pert, the body is the subconscious mind, and the emotions are what glues body and mind together, and it has impact on every single system of the human body. So it's really important for healing what thoughts and what emotions we are experiencing. In the words of author Greg Braden, the language of consciousness appears to be the universal experience of emotion. And it can be said in a very simplified way that negative emotions facilitate illness and the positive emotions tend to cure illness. And there is evidence for that in positive psychology. There's evidence about gratitude, about compassion, about anger, and this relationship throughout the field of mind-body medicine is now well established. So the healing mindset. The principles of the healing mindset. First of all, and I really care to express it very clearly, that health is not merely physical. Health and healing need to be addressed from a whole life perspective. And both patients and doctors are invited to pursue a journey of wellness and self-growth. Why doctors as well? Because, in the words of Mahatma Gandhi, become the change you want to see in the world. every change begins with a single person. So this change, also this is a modified version of Ken Wilber's model. When the change happens in the I, in our inner world, it can influence through the connections that we make, through the quality of these connections. It can influence culture, society, and the world. So it may be useful to bring the light of awareness to your own role and think, who am I as a doctor? What do I wish to convey to my patients? What are my personal experiences with disease, and what have I learned from them? Am I at peace? Is there anyone I need to forgive? Do I practice self-care? Do I know how to relax and rest? Am I acceptant? Am I a loving person? And while reading through, because I'm reading through mostly books written by physicians and their experience of practicing medicine, also my own experience as a wellness coach and my whole life experience, I came up with a model that is, in my view, a foundation for the healing mindset, the healing wheel. And I will briefly discuss each of the components of this model. So self-responsibility and empowerment, how many times, this is the number one and most vital one, how many times when we have disease, we think that it happens to us. We don't make the connection that they're to our inner world. And instead of saying, poor me, and feeling victimized, we can adopt a mindset of understanding, what am I supposed to learn here? And I have the power to recreate my health with a deep belief. Self-love and self-compassion, this is a letting go of fear and being self-kind, in the words of researcher Dr. Christine Neff, who divided self-compassion into three core components: self-kindness, common humanity, then we're all in it, in the experience of life, and mindfulness, so holding our experience in balanced awareness. Peace and relaxation. This has also been proved in a scientific way by the mind-body effect and the relaxation response by Herbert Benson. When you're happy, relaxed, and free of stress, your body can accomplish feats of self-repair, and the state of mind changes the state of the body. Connectedness and support. Connectedness to own body and connectedness to others, and reaching out for support, because receiving is an act of giving as well. Forgiveness and gratitude. How many times we think that we are forgiving others for them? Well, in fact, we're doing this for ourselves. And this is also a prerequisite for the healing process. Gratitude changes the energy field. Love and positivity, not dwelling in negativity. It has been proved also by Dr. Bruce Lipton how our lifestyle, our beliefs, the levels of stress can influence the readout of our genes and decide whether it will express as disease or not. And unconditional love is the most powerful known stimulant of the immune system. Acceptance and surrender. How many times we fight, we resist, we don't want that, what is happening? Well, the pathway to healing is through acceptance, and sometimes it needs to be, the loss of health needs to be grieved through the stages of grief as defined by Elizabeth Kubler-Ross. And finally, the purpose and service. I've noticed that disease was sometimes a sign of a meaningless life. And reaching out to others and being of service for them is also a pathway of healing. And it brings us to the definition of wellness that I came about as wellness becoming fully alive and expressed in and for the world. So the conclusions. The growing field of wellness coaching has an enormous potential in healthcare. There is growing evidence for the effectiveness of making it an integral part of the medical model. I myself work in a hospital setting and coach patients. Coaching ought to be subject to further rigorous and long-term research. In the light of the wellness theory, medicine becomes treatment plus wellness, while coaching is an ideal component which closes the gap between the current reality and this ideal state. The evolution of mindset must be based on the understanding that health is not merely physical, as well as the awareness that when thinking of health and healing, there is a need to address the whole being of the patient, and it is vital for the evolution of medicine. And medical doctors have the power to convey this message to their patients, and they can do it by pulling from their own experience and their own wellness journeys towards self-growth and self-actualization. When I'm thinking about the potent role of the medical doctor in changing and in providing the evolution of medicine for the good of the patient, I'm thinking that your patients will not always go and take a relaxation class or a mindfulness training. They will not always go and see a psychotherapist, let alone a wellness coach. But they will continue coming to see you. And you have profound impact on how they perceive their health and their healing journeys. You have the power to co-create the medicine of tomorrow. Thank you.